If you're a parent, there's nothing more important than understanding your child's development. So today, we're going to talk about something that's on a lot of parents' minds, but can feel a little scary to approach: how to recognize the early signs of autism. This is all about giving you clear, supportive information straight from the experts.
Okay, let's just dive right in. But we're not going to start with some dry clinical definition. No, we're going to start with the why. Why is it so incredibly important to notice the signs of autism as early as humanly possible? Because, and this is the key, understanding what's at stake can completely change a child's future.
This is it. This is the question that really gets to the heart of every parent's biggest worries. If we don't catch these signs early on, what does that actually mean down the road? What are the real-world consequences? Well, the thing is, when we wait too long, the challenges can really stack up. We're talking about a child having a really tough time making friends, which can lead to feeling profoundly lonely. And that doesn't just go away. It can stretch right into adulthood, making things like living on their own much harder. As they get older, they become more aware of these differences, and without the right support, that can cause a ton of stress. But the biggest thing, the most important one on this list, is that we miss a critical window when a child's brain is at its most flexible, just ready to soak up new skills. So, with the stakes being that high, it is absolutely crucial that we get on the same page about what autism spectrum disorder actually is, and maybe just as important, what it isn't. The very first step is clearing away all the myths and misconceptions. So autism spectrum disorder, or ASD for short, is what's called a neurodevelopmental condition. That's just a technical way of saying it has to do with how the brain develops and gets wired. It mostly shows up in three main areas: how a person interacts socially, how they communicate, and their behavior. Now, that word spectrum is everything. It means autism looks completely different for every single person. And the signs almost always start to show up really early, usually before a child is even 3 years old.
Okay, now this slide, this is huge because it cuts through so much of the noise and the anxiety that parents feel. Let's just be crystal clear. Science tells us that autism is absolutely not caused by watching too much TV or using an iPad. It is not caused by something you did or didn't do as a parent. It's not a disease that needs to be cured. It's just a different way of developing. And the idea that everyone with autism is the same, that's completely false. It's a spectrum for a reason.
And this quote from child health specialist Dr. Ho Ton Thien Na really nails it. The current scientific thinking is that the foundation for autism is genetic. It's there from birth, written into a child's code. The signs don't just appear out of the blue. They just become easier for us to see as a child gets older and starts hitting or missing those typical developmental milestones. All right, so we've covered the what and the why. Now let's get down to the how. What are the practical, real-life things that you, as a parent, can actually look for at different stages of your child's first few years? In that very first year, the signs are often really subtle. It's more about what's not there in terms of social connection. Maybe the baby doesn't make a lot of eye contact, or they don't give you that big social smile right back. Maybe you call their name and they don't turn their head. You might also notice they aren't babbling or using gestures like reaching up to be held. Dr. Naga has this fascinating term for it. She calls it a slippery baby, describing how some infants might almost arch away from a hug because they're not seeking that close physical connection. Now, between ages 1 and 2, things can become a bit more obvious, especially around communication. You're looking for language milestones, like having some single words by about 16 months, but here's a big one, a really, really big one. By 18 months, is your child pointing at things just to show you something interesting? It's not about wanting the object, it's about sharing an experience with you. Like, hey, Mom, look at that airplane. That lack of shared attention can be a key indicator. This is also when you might start to see repetitive behaviors like flapping hands or spinning around. Once a child is over 2, the social differences can really stand out. You might notice they seem to be in their own little world, preferring to be alone. They might get fascinated with just one part of a toy, like spending hours just spinning the wheels on a toy car instead of playing with the whole thing. A really strong need for routine is also a classic sign. A tiny change, like taking a different route to the store, can cause a major meltdown. And you might see unusual reactions to things like loud noises or the feel of certain clothes. Okay, let's pause for a second, because for so many parents, the first thing that makes them worry is speech. It's probably the #1 reason families start looking for answers. So let's just tackle this question head on. If my child is slow to talk, does that mean they have autism? First things first, and I really want you to hear this, a speech delay does not automatically equal autism. It just doesn't. Many kids are simply late talkers, and they have no other developmental issues whatsoever. And this is where you can see the crucial difference. A child with a simple speech delay will still be trying their best to communicate with you in other ways. They'll point, they'll use gestures, they'll pull you over to the fridge, they'll make eye contact. They want to connect. With autism, the challenge is often broader than just the words. It's about that underlying motivation for social interaction and communication, both with words and without.
Okay, so you've learned the signs, you've taken all this in, and now you might be feeling a little concerned. And that can be a really overwhelming feeling, I get it. But this isn't a moment to panic. It's a moment to make a plan. So what are the concrete, empowering steps you can take, starting right now?
Look, it really comes down to this simple 3-step plan. Think of it as a roadmap. It's designed to take you from that feeling of worry and uncertainty to a place of proactive, positive action for your child. Step 1, and this is the most important one, talk to a professional. Please don't fall down the late-night Google rabbit hole trying to diagnose this yourself. Your pediatrician is always your best first call. They can point you toward a specialist. Getting a real, official evaluation is the only way to get true clarity and unlock the right support. Now, let's be real. Sometimes getting those appointments can take a while. So what do you do while you're waiting? You do the most important and powerful thing you can possibly do. You connect with your child. Your love, your patience, your nonstop efforts to engage them, that is your superpower. This isn't about fixing them, it's about being there for them. And finally, step 3. If a diagnosis is confirmed, the next move is early intervention. And honestly, this is the most effective tool in the entire toolbox. It's not a cure, it's a set of specialized therapies, things that focus on behavior, speech, and social skills, all designed to help your child learn the skills they need to navigate the world and thrive. And as we start to land this plane, I want to leave you with this powerful thought from Dr. Nenga. She asks, can autism be cured? And she answers, no. But that is not the end of the conversation. In fact, it's the beginning of a new one. A diagnosis isn't a dead end. It's just a different path, with its own unique possibilities for greatness. So many people with autism have these incredible, unique strengths. We're talking about an amazing ability to focus, a stunning memory for details, a way of seeing patterns in the world that the rest of us just miss. Dr. Nambagenda talks about a famous tech billionaire and a world-renowned professor who both have autism. Their stories just go to show you that with the right support, the potential is absolutely immense. And that's really what this all comes down to, isn't it? Every single child, no matter who they are, has this incredible, unique potential inside them. And our job, as parents, as friends, as a community, isn't to try and make them fit into some cookie-cutter mold. It's to understand how they're wired and then give them exactly what they need to unlock their own brilliant potential.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.